that are fundamentally making a difference.
Question number 10, Kris Faafoi.
Mr Speaker, my question is to the Associate Minister of Health and asks, does she stand by her statement that the measures in the budget to change the asset threshold for aged residential care were, quote, a reasonable approach to the way forward?
The Honourable Joe Goodhew.
Te lofa lava, Mr Speaker. Yes, I do, within this context. The Government has slowed the rate of increase of the rest home asset threshold in recognition of tight financial times and an ageing population. On the 1st of July, the threshold will increase from $210,000 to $213,000, $300.
Kris Faafoi.
Supplementary, Mr Speaker. Which non-government individuals or groups, if any, were consulted as part of the process leading to the asset threshold change?
The Honourable Joe Goodhew.
Mr Speaker, the decision was announced in the Minister of Health's main press release. Prior to the budget being read in the House,
Order, I want to be able to hear.
Prior to the budget being read in the House, I phoned and spoke to both Grey Power and Age Concern to talk with them about this change and to also talk with them about the investments that we are making in this sector, which are $40 million more for residential care, $40 million more for dementia care, $40 million more for home support, and $1.5 billion total more for health over 4 years.
Kris Faafoi.
Supplementary, Mr Speaker. Does she concede that the change made last week does not address serious issues raised by the Human Rights Commission report, such as pay parity, staff training and quality of care standards?
The Honourable Joe Goodhew.
Speaker, the Human Rights Commission report last week contained 10 recommendations. The Government will carefully consider those recommendations. Amongst those recommendations are a number of issues that the Government is currently working on, and I talk in this case about quality of care, about rural funding for care, about training for caregivers, and so therefore I would say to the member that in fact we are addressing many of the issues raised in that report.
Supplementary.
Kris Faafoi.
Does she agree with the Prime Minister's plan to address pay parity and workforce supply, given he said to media yesterday, you know, New Zealand might take a different view on migration and, you know, there might be a converge of, you know, Filipino nurses that want to come and live in New Zealand or whatever it might be?
The Honourable Joe Goodhew.
Mr Speaker, the best thing that this Government can do and has decided to do to actually address any need for further funding into aged care is to get our books back into surplus by 2014-15, and that is the main focus for this Government in order to then look at the priorities, which will include looking at the possibility of more funding into aged care.
The Right Honourable Winston Peters.
Could I ask the Minister...
Order, I want about...
New Zealand first.
Order, I apologise, the Right Honourable Member, but I do want to be able to hear this supplementary question. The Right Honourable Winston Peters.
Could I ask the Minister, given that New Zealand First secured an additional $580 million in aged care support to address the PricewaterhouseCoopers report of 3 years before that, why is it a reasonable approach to the way forward, as she says, on the threshold for aged residential care to inflation index that, yet provide from her government no inflation indexing whatsoever of residential care allowances since they came to power?
The Honourable Joe Goodhew.
Mr Speaker, in fact the member is incorrect because cost price increases are passed on from the DHB, but I want to also add that in fact the PricewaterhouseCoopers report has been superseded by the Grant Thornton report in 2010. That report identified that the most need in the aged residential care sector for additional funding was dementia care. In budget 2011 we put an extra $40 million towards aged residential dementia care, a further $30 million in this budget to aged residential dementia care, and $10 million towards dementia care pathways in the community.
Question. Order. Question number 11, Eugenie Sage. Order. Order. I'll ask members, please, on both sides of the House to show some courtesy to a member at the back. I want to hear a question. Eugenie Sage.